So whenever you come into care with us, we usually do labs that are called NIPT labs. So we do first trimester and then 2 third trimester labs. The first trimester labs is going to be a urine sample, which we do a urine culture and STI testing off of. And then there's going to be a blood draw, which is a CBC to test like where iron levels are and where your just blood levels are. And then we do an RH blood type to figure out mom's blood type. And then we also do STD testing through blood as well. The 28-week labs is another CBC to kind of do a double check on how their iron levels are doing later on in pregnancy. 28-week labs is going to be very similar to the NIPT labs. It's just not going to have a couple of the tests in there. It's going to be an antibody test, a glucose test, because that's when they do their 1-hour glucose where they take the 50 milligram drink. And we draw their blood on the hour to kind of see how their body is processing that glucose. And if they're not processing the glucose well, if their levels aren't where we'd like to see them to be, we have them come in and do a 3-hour glucose. And then we also do a repeat STD screening with blood work as well. The same STD screening that we do in the first trimester. And then another option for first trimester labs is going to be the NIPT testing. It's genetic testing, and it's going to test for trisomy 18 and 21. It's going to be basically just genetic abnormalities that we would like to know what's going on with the fetus early on. And it's also going to test to see if mom is a carrier for anything that she could pass down to baby. But I jokingly tell my patients all the time that the number one reason why most patients do that test is to find out the gender early. It's kind of like a nice little incentive. And the thing I like about NIPT, which is the company that we use is Natera, is that they do sliding scale and they do accept most insurances, major insurances, and they also accept Arizona Medicaid, which is also great for our clients. It's a really great option specifically for first-time moms as well, because they probably never had genetic screening before. And then the last third trimester lab that we do is going to be the Group B strep swab. And something that I think that sets Willow apart is that we allow our clients to do that swab themselves. It's non-invasive. They just go into the bathroom, swab themselves, and it just tests for a bacteria that we would need to know that they have just in case they're in labor. We can give them some antibiotics. So, yeah.